Hi, thank you for joining us. I'm your host, Nada Youssef. And as we continue our celebration of Women this month, we're putting you first by talking about your weight and how to manage it properly. And weight management can be a very tricky thing with chronic illnesses, a poor diet, lack of sleep, stress, pregnancy. So today our featured expert is the Director of Weight Management at the Women's Health Institute, Dr. Karen Cooper. And before we get started, please remember this is for informational purposes only, and it's not intended to replace your own physician's advice. Thank you so much for being here today.
Thank you for asking me.
Sure. And if you want to just introduce yourself to our viewers real fast.
Okay. So as Nada said, I'm Dr. Karen Cooper, and my specialty is in obesity medicine. I am a primary care physician, but I focus on women who are having issues with weight management in relation to a variety of issues. So polycystic ovarian disease, menopause, infertility, metabolic diseases like hypertension, diabetes, sleep apnea, sometimes pregnancy, before pregnancy, during pregnancy, after pregnancy, and it's fun. It's a lot of fun. I get to meet a variety of wonderful people, and we usually have a great time.
Oh, well, we have a lot to cover then. So I'm going to start with pregnancy because I always hear the term, I'm pregnant, so I get to eat for two. So then you're thinking like 2 plates of the same thing, or what is the normal weight gain for a pregnant woman?
Yeah, so this is the thing. There's the conception out there that once I get pregnant, I can eat as much as I want to, and then all the weight's going to come off, but it's actually not true. We really don't need that much extra weight. So as much as maybe 300 extra calories per day when we're pregnant will be more than enough for our baby, our growing baby. And that could easily be something as simple as an extra apple, piece of fruit, and slice of bread with peanut butter, maybe a little bit extra rice along with some protein. It's really not that much more. Yeah. So NIH has specific guidelines in terms of where your weight is right now and how much weight you should gain, and you can certainly talk to your doctor about it. But there's a certain amount of weight that should be gained during your pregnancy just to make it optimal for you and for your baby's health.
So don't go for what about like the cravings?
I know,
I'm craving
pasta,
I'm craving pizza.
I know, and that's the thing
Don't
that you
give
can't
in.
really turn off. And it's not that you shouldn't give in, but you need to do everything with moderation.
Sure.
So if you really have that craving that you cannot turn off, sure, go take a bite of something.
Okay.
Just knowing that, okay, you don't want to finish the whole tub of ice cream.
Sure.
So yeah.
And then so what I heard you say is it's about 300 calories, so that could be just 1 apple.
Well, no, that will be a couple pieces of fruit.
Okay.
Yeah.
Okay.
If
great.
you have a fruit craving and
Sure.
Yeah.
A little bit of sugar. Okay, great. What about some exercising tips for pregnant women? Because I know that's something that you want to keep healthy, but they tell you if you weren't exercising that much before pregnancy that you should not exercise as much?
So
or how's that
typically
work?
you can follow within reason the same exercise activity that you were engaging in before. I mean, if you were horseback riding, you don't want to do that.
Yeah.
You don't want to engage in any exercises that will put you in a place of instability.
Okay.
Right? So your exercises should be low impact, and they should be where you're stable, where there's not a chance for you to fall.
Okay.
And where you're
Safe.
Yes, exactly. It should be safe, where your weight is supported, because you have this growing baby, and so that takes the whole frame off balance.
Sure.
So it's really important to have both feet planted on the ground, and just make sure in a safe environment, if for some reason you were to fall, that it wouldn't be, something that would be very traumatic.
Sure.
So, but really making sure that you're avoiding ththings that can actually hit the stomach.
Right,
just be very safe.
Okay,
Yeah.
great. All right, so the ultimate diet for weight loss. I was going to ask that. For pregnant women, should they be eating more fat or less fat? And then just for any woman, not just pregnant women.
Pregnant women need good nutrition. We all need good nutrition.
Sure.
Okay, and there are a couple things that are focused on during pregnancy, like folic acid and so on. And obviously, we always tell our pregnant patients to make sure you take your prenatal, because that has extra vitamins, iron, and things that we really want them to have, so that the baby can get those nutrients during pregnancy. We do not place our pregnant moms on diets. That's a no-no.
Right. Okay.
But we will look at your diet, and we will make sure that you are eating the foods that you should be eating to get the best nutrients, and that you're eating them in the correct portion sizes.
Great.
So no diets for pregnant women.
Yeah.
And there's really no ultimate diet, period.
So many trends out there. How do we choose?
There
How
are
do we
tons
know?
of trends. There are tons of trends out there. The first thing is the first thing you want to do is make sure, in conversation with your physician, that it is a safe diet.
Right.
It's not something that's going to throw your physiological system out of whack.
Sure.
Right?
Sure.
So it has to be a safe diet, something that's not going to put you in the ER.
Right.
Right? But then also it has to be something that you can manage.
Sure.
Right? So some people are vegetarians, for instance, but there is the trend now to do more high protein, low carb, and most protein is, fish and chicken and steak and things like that, and vegetarians, they're not going to indulge.
Right.
So it's really about what are the types of foods that you eat, what do you feel is suited for you, and what do you think you can give up?
Right.
But most importantly, it's got to be healthy. I mean, it's got to be a safe diet for you.
And the word diet could be very tricky because it always sounds like it's something that, we just get into just in a temporary state. But if we're talking about like a lifestyle diet, like what we should be eating, there's Mediterranean diet, there's a keto diet, there's fasting. What do you recommend? What do you eat?
So what I recommend is everything. You have to be very aware of your portions.
Yes.
Right? And if you can get a variety of foods, that means that you're getting a wide range of nutrients for your body's needs, right?
Great.
Typically, if we restrict or reduce a particular food, we're going to see weight loss. And when we use the word diet, we tend to think of it as something temporary.
Right.
But truly, everything we eat every day on a regular basis is our diet, right?
Mm-hmm.
But when you're looking to lose weight and you say, oh, I want to go on a diet, you should consider it from a temporary standpoint, because that's not something you're going to continue the rest of your life.
Right.
Okay?
Right.
So some people will go on a particular diet type to get a larger amount of weight loss, perhaps, or faster amount of weight loss based on the diet type. But really, if you continue eating the way you normally do, if it's a healthy type diet, and you reduce your calories, proportionally per day, you will get some weight loss. You just won't get the 20 pounds in 2 weeks that you're looking for.
Right. It won't be as fast as we want it to be.
Yes,
sure.
Exactly.
Well, let me ask you this: weight loss medications and pills that are those safe? Are those safe? Because it's something, it almost sounds too easy that I can take a pill that'll make me not hungry or that'll make my fat go away. So are those safe? And what do you have to say about those?
There's no pill that will make your fat go away.
There's no magic pill?
There's just nothing that will make the fat go away. We wish.
Yeah, right, exactly.
Yeah. What I think everyone needs to understand about weight loss is that you're losing weight, whether it's through a diet or medication or surgery, because what you're taking in is being reduced.
Right.
And some people do need the help of medication to get from point A to point B. Because when we gain weight, it's not just about the way we look or the way we feel, but it's also what diseases are we, putting ourselves at risk for because of the increased weight.
Sure.
And there are times when medication is really necessary just to help that person get the weight off so that they can be at their optimal health.
Okay.
Right? And then medicines are also very good in terms of an eating disorder. We do have the eating disorders, and so that needs to be evaluated by a psychologist and a physician, and medications can be incredibly helpful in terms of eating disorders.
Sure.
So the patient always needs to be monitored. It shouldn't be medication that you bought off the internet.
Yeah, right. So if you're a healthy person and you're able to exercise and eat well, you shouldn't be going for medication.
Well, I don't say shouldn't. It really depends on your body mass index. The NIH has specific guidelines in terms of what your body mass index should be when we're prescribing medications. And as medical care providers, we have to follow that.
Yeah.
Otherwise, we're putting your health at risk.
Sure.
Right?
Sure. And then before I go forward here, can we talk a little bit about BMI, what it means, what's healthy, what's not, when we should see a doctor?
So the body mass index is an average of your height and your weight. We get this number, and it tells us, it's really more to give us a range of where you are in terms of health. It is not accurate. And I think a lot of people get so hung up on that number, So normal is between 18 and 24.
Okay.
Right? 18 and 24.9. And overweight is from 25 to 29.9. Obese is 30. And it keeps on going,
yeah,
right?
Yeah.
You can get to morbidly obese where you're 100 pounds or more overweight and your body mass index would be around 40. The only reason we're looking at those numbers is to determine what you're at risk for in terms of disease processes, because we want to dive in.
Sure, sure, of course.
And we want to take care of it.
Sure.
Right? Also, if you already have a disease process, the increased weight is going to make it worse. So we also want to address it just based on that. Do you have diabetes and is your body mass index 35? Well, we know that if we help you with the weight loss, your diabetes is going to improve. Okay. It might even resolve if it's diabetes type 2. Yeah. However, if your weight keeps going up, if you may get to the point where you need insulin, if you're not already on insulin, you know, at that time. So it's really important to look at it from, you know, a full range perspective of how healthy am I? Am I putting my health at more risk?
Sure.
You know, but not, okay, I've got to get between these two numbers because if I don't, you know, so it's that type of thing.
So then you mentioned type 2 diabetes, you can take your insulin number down with diet?
Type 2 diabetes, you can bring your body mass index down.
Oh, okay, your body mass index, okay.
If you are losing weight with a medically supervised diet plan or a healthy non-medically supervised diet plan and with exercise activity.
Yes.
The one thing people don't realize is how terrific exercise is for us. Even if you don't lose weight with exercise, and most of the time you do not, it helps to maintain your weight.
Right.
It is going to lower the blood glucose. It's going to bring the blood pressure down. It's going to make you feel great. It's just going to do
the
so many
happy
great
feeling,
things.
right?
Yes,
yes, great.
Yes.
Okay, well, I'm going to jump on to a little game.
Yes.
I'm just going to throw out a statement out there, and I want you to tell me if it's a myth or a fact.
Okay.
And then just explain a little bit about it. So,
okay.
First one is about skipping breakfast. Can skipping breakfast cause me to gain weight?
Yeah. So that's a myth.
It
right?
is.
It is. We are pushed all the time. Eat your breakfast, eat breakfast,
most
eat
important
breakfast. Yes,
meal of the day.
Yeah.
Yeah.
It is important because you haven't eaten for several hours.
Sure.
You know, if you've gone to bed at the right time.
Yeah, right. It's true.
You know, it is important, you know. However, a lot of us are not breakfast eaters. And so our bodies might naturally want to eat later in the day. It is perfectly okay to eat later in the day. Okay. What I like to tell my patients is eat when you're hungry. Yeah. If you eat when you're hungry, not when you're starving. If you eat when you
don't wait that long.
If you eat when you're hungry, not only are you going to enjoy your food better, you're going to eat the right amount of portions for you. Okay. Sometimes if we're not breakfast eaters and we try to fit into that mold of you must eat breakfast, we're really taking in more calories during a time when it's not really registering that, hey, you're hungry, we're filling, you know,
your body's
you're getting,
you're
getting filled, because let's just say you're like an 11 o'clock eater. You get up at 6 o'clock. You get up at 6 o'clock, you're like, okay, I need to have breakfast. Yeah. You're still going to be hungry at 11. Yes. That's your norm.
Right.
And so you've taken in these extra calories. So unless you reduce what you eat at 11 o'clock, you've now added more calories to your day that you may not want.
Okay, you made my day. I skip breakfast all the time because I'm not a hungry person in the morning.
Well, so. You know, I have in defense of the registered dietitians who I adore. One of the reasons that's said is because skipping meals can cause you to overeat.
I see.
If you're going to overeat because you skip breakfast, you do not need to skip your breakfast.
And that's why I eat when you're hungry. Whether it's morning or 11 a.m. or 12 p.m.
Right.
Okay.
Exactly.
Great.
Exactly.
All right. So we got that one. Yeah. Okay, and you should you should eat as much fruits and vegetables as you want, and you will never gain weight.
Such a myth.
Okay,
such a myth. Such a myth. Okay.
Is it the sugar content? What is it? Sugar?
So, fruits are healthy for us.
Yes.
Vegetables too, but they're not free foods.
Right.
They have calories. So if you require a certain amount of calories to keep your weight a certain weight,
sure,
and you eat more than that, you're going to gain weight, whether it's a piece of fruit or some chocolate or lettuce or, you know. Right. So because we tend to think foods that are healthy for us, we can eat as much of it as we want, and that's not true. We want you to eat healthy foods,
Yeah.
right?
Yeah. Majority of your plate should be vegetables and some fruit, correct?
Not necessarily.
Okay.
It really depends on, well, it should be a variety.
Sure.
Right?
Sure. It's always about moderation, variety, and portions.
Yeah, exactly.
Slow it down.
It should be about variety. It should definitely be about portions.
Okay.
Okay.
Great.
Get the protein in there.
Yeah.
Fruit is a form of sugar. It's healthy,
Yeah.
you know, it's got sugar, it's got vitamin C, sometimes some of them have vitamin E and other vitamins, almost all of them have fiber. It's really great for your body.
Yeah.
However, it's the sugar component you're looking at.
Right.
So if you go above the amount of servings that are recommended per day,
Sure.
then you're going to gain weight.
Sure.
So it's not a free food.
Yeah. Okay.
And the same thing with vegetables. We've got vegetables that can be starchy and non-starchy.
Right.
The starchy ones, potatoes, corn, peas.
All the good stuff.
Yeah. Right?
It's hard.
Right.
Yeah.
In moderation, but not free foods.
Yes. Okay,
So,
great.
yeah.
Perfect. How about, you know, I drink a black tea, but I'm putting honey instead of sugar.
Yeah.
Is that better?
So honey is fruit sugar, fructose, right? It's made
Yeah.
with fructose, so it's still sugar.
Okay.
So again, there's the understanding that it's healthier,
Yeah.
but it's just a different form of sugar.
Okay.
And if you have an upper respiratory infection or something, you may feel better going down your throat,
Yes.
whatever. However, it still has, actually it might even have more calories than sugar, because we're going to,
Really? Wow.
most of the time we tend to put more honey in
Thinking
than we
it's
would.
a free for all.
Yeah, again, it falls into
You're
that. I think it's a free food.
I do. I always hear that honey is healthy. It's like what my mom always told me.
It is healthy. Again, you have to measure it.
Yes, exactly.
Sugar.
Measurement is important.
Yeah.
Okay, so if I late night snack, I'm going to gain weight for sure?
It depends, right? So one of the reasons that the thought out there is you should stop eating at 7 o'clock in the evening or whatever is because in the evening we tend to be more relaxed.
Yeah.
When we're relaxed, we tend to let our guard down and we tend to eat more.
Yes.
So the trick, if I want to call it that,
Yeah.
about eating later at night is to, again, be aware of how much you're eating. Again, if you've got a certain amount of calories that's going to keep your weight at a certain level, if you eat all of them at 11 o'clock at night,
Yeah.
you, you know, it's not
Yeah.
going to make a difference.
Sure.
But if you add more than that, yes, you're remembering that you seem to have eaten more at night, and that's why you keep thinking, you know, oh, it's probably because I've eaten late.
Right,
at
right.
nighttime,
And then, of course,
but
it's what you're eating. I mean,
it's also
it
what
could be
you're
nachos
eating.
and cheese, or it
It's-
could be an apple and
It's
some nuts,
also
right?
what you're eating.
Yeah,
Well,
yeah.
there we go. Nuts are healthy for you, but they do have quite a bit of fat.
Yes.
So, you know, maybe about 10.
Yeah.
Count
Okay,
them
10?
out. 1, 2, 3, 4, 5,
Wow.
6.
That, they never go just for 10. It's always more than
No,
10.
no.
I'll keep that in
yeah.
mind for next time.
Yeah.
How about lack of sleep, though? You know, I've read a lot of studies where lack of sleep causes you to crave sugar or crave junk food, which causes weight gain. Is that true or false?
Yes. So if you are tired, you're going to want to get your energy up during the times when you really need it, right? So if you're feeling tired, you're going to reach for caffeinated beverages or things with sugar because sugar does this, so it makes you feel more energetic.
Yeah.
And so that's why we tend to crave more carbs, which are sugar, right? When it's all broken down. We tend to crave more carbs, more sugary foods, more caffeinated beverages when we're tired, and that can lead to more weight gain.
Okay.
So apart from, you know, not getting enough rest during the night, that can be a variety of factors. And the one thing I think people really need to know about a lot is the idea of sleep apnea. You know, sleep apnea is a disorder that does not allow you to get enough rest even if you slept for 8 hours. And so that you're going to be tired during the day, and it's going to be that vicious cycle of I'm tired, I'm eating more food, weight gain.
Okay, so sleep longer.
Yes.
Well, how long
better.
is good? Like 6 hours?
Again,
I can't answer that one, huh? I mean,
It
I'm guessing. I mean,
depends.
how many hours can we really get if we really want?
But you know, really, it depends on the individual. Some people can function
on 5
incredibly
hours,
well off of 6. I think the latest literature out there is between 6 and 8 hours, and that it changes depending on your age.
Sure.
Right?
Okay, great.
So, yeah.
All right. And does exercising increase metabolism?
exercise does increase metabolism.
Does.
So when people come in saying, I have a slow metabolism, my first question is, how much are you exercising?
Right.
Right, and the thyroid, it controls, controls our metabolism, and so that's another thing to look for. If you think your metabolism is not where it used to be,
Sure.
that's something that your doctor can easily do a blood test to determine what's going on with your thyroid.
Okay, so to check thyroid is blood test, and that could be slowing down your metabolism.
Absolutely, it can have an effect on your metabolism.
Okay.
Depending on what the thyroid disorder is either slowing it down, revving it up, or revving it up, right? Or causing some kind of problem. However, as we get older, our metabolism slows down.
Yeah.
Right? And so there are just some things we have to get used to as we get older.
So
that's
we're
one
have
of
to
them.
Find a way to reverse aging.
Well,
it's like all of our problems.
oh, I would love that. And exercise, again, is one of those things. I can't talk enough about exercise activity. Honestly, it's like one of the best things you could always do for yourself.
So what's your tip for someone that's like, I don't have time to exercise. I can eat healthy, but I don't have time to exercise.
First of all, you're going to get the eyes.
Yeah.
Make
I
time.
got those eyes, yeah.
No, it's incredibly important.
Yeah.
You've got to put that into your day. If you're going to be a successful, effective person, if you're going to be your best, if you're going to have optimal health, you've got to get exercise activity in. Just read a study yesterday that just showed, we talk about exercise a lot in terms of heart disease and heart attacks and high blood pressure and so on, but we don't talk about some other chronic conditions like heart failure. We don't have anything really that cures heart failure.
Right.
We can do certain procedures, interventions when you've got heart attacks and arteries that are blocked.
Right.
But in terms of heart failure, when your heart is really not working at its best, that's something that exercise activity can prevent, ward off, or moderate. And so,
and it doesn't need to be vigorous. I mean, it could be walking,
not.
Right? It could be walking half hour a day. That would do.
So sometimes I try to stay away from the E word, and I just say move as much as
I
move
like
more,
that better.
move more than you normally do.
I like that.
Right? Move more,
That's
dance.
Because exercise, you're thinking of CrossFit, and
Right.
sometimes you're like, I don't have time, but
or
walking,
you just
moving.
don't want to, be that intense.
Yeah.
Maybe you've had a rough day. You don't want to be that intense, and just go outside.
Go dancing.
Yeah,
do
go
something.
dancing. Do the fun thing.
Zumba. Yeah.
Move more than you normally do.
Good. All right. How about, let's see. So is gaining weight during or after menopause inevitable?
Ooh. The thing I don't like about menopause is it disrupts those hormones and just sends us into...
How do you control at that point, huh?
Yeah. Unfortunately, pretty much everyone is going to get the spread.
So everybody's going to gain weight?
Yes.
During menopause?
I want to say no, it's not sealed in stone.
Yeah.
But yeah, it's inevitable because it's affecting our hormones, which tend to regulate, our fat storage and so on.
Okay.
And so, but you can ward that off. You can be proactive,
Sure.
So knowing that, being very aware of when you're getting into that phase. You're going to have symptoms. Make sure you're seeing your doctor regularly so you can start talking about preventive measures for the things to come.
Sure. And then everybody's different, right? Like, what are the first symptoms of menopause? I mean, everybody's different.
Everyone is different.
Yeah.
And, it takes us a certain length of time, and some people's time is shorter, some is longer, and so on and so forth.
Okay.
However, I think the number one thing is that for most women, we're going to not quite feel ourselves.
Sure.
But yeah, so the weight gain comes because there's a change in the hormone levels, and so we have less estrogen during that time. And unfortunately, that promotes more weight around the stomach.
Okay.
And so if we are monitoring what we take in, we reduce our fat content, do more exercise activity, we have a chance of of really being victorious around that time.
Okay, great. Excellent.
Yeah.
Okay, increased stress level hormones can contribute to weight gain. And then how to cope with stress.
Yeah, and so a lot of
about
us
those
cope with stress by eating.
Okay. Cope with stress by eating? So eat more.
No, I'm not saying you
eat
should.
less.
A lot of us do. So when we get stressed out, cortisol, which is like a steroid, we release more in our bodies, and that tends to promote more inflammation. Also, it can promote more of an appetite.
Store your fat.
And so it's really important to get the stress levels under control. So if you know you're going to have a particularly stressful week, if you can make sure that you get more exercise activity in, you get more rest.
Sure.
Or if you have your go-to for stress release, blast the music in the car all the way to work. Use a few sentence enhancers by yourself.
Sure.
Do what you need to do, dance, get outside, try to incorporate some things that are stress reducers for you throughout the day maybe, if you can't all wait until the whole day is over, and that's going to be pretty effective. But it is important to know that it does increase our cortisol levels, and so it's going to make us go a little crazy in terms of carbs.
It takes everything out of whack.
Yes.
Okay, one last question for you. I'm going to some live questions because we're getting some, but I wanted to ask you, a lot of people are fasting this month for Ramadan. Do you talk?
That's right.
Yeah, so like with fasting or intermittent fasting, any take on that? Is it healthy? There's a lot of research, or there's not? What's going on with that part?
Yeah, so let's go to the fact that this is the month of Ramadan, and they are, observing their faith and they're fasting. And it depends on what your conception of fasting is. So I believe within that spectrum, it's, abstaining from foods until a certain time, and then you can eat a certain type of food or amount of food. Okay, but there's fasting from the standpoint of there are many different types of fasts. You can do an all-water fast. You can do just a beverage fast. There's the Daniel fast. So yes, which a lot of Christians tend to engage in during the beginning of the year with their churches and things like that. And that pulls out red meat and tends to be a healthier way of eating. Pulls out sugar and things. So it really depends on what the fast is, right?
Well, your body not taking in calories for 14, 18, or even 24 hours. Is that cleansing your body? What is that? There's benefits to that? I've heard about benefits.
Our bodies are so amazing.
Yeah,
we can cleanse without a cleanser.
Okay, yeah, right, exactly. We don't need anything to cleanse.
You don't have to fast to do that, right? Drinking enough water, exercising, sweating, you're getting all those toxins out and things like that. You don't actually have to induce it. But people like the idea of fasting because they're thinking of weight loss, or they're thinking, again, like you said, maybe I'm going to get healthier. Not necessarily true. You can lose some weight if you're fasting, but it depends again on the type of fast, and it also depends on how long you're doing it. And some fasts can be dangerous.
You have to be healthy to fast as well.
Well, I think the first question is, what are you doing it for? What's the reason behind it? If you're going to have a surgical procedure, you might have to abstain from food for a certain number of hours. That's a fast.
Absolutely.
Right? Until the procedure. So really, I think in terms of fasting, you need to be very mindful about the reason behind the fasting, whether it's going to be healthy for you, have a conversation with your medical care provider to determine, is this the right path?
Great. All right. Well, excellent. You've been great. I'm going to go ahead and go some live questions. I have Joan. Can we speak about genetic or epigenetic issues that affect weight?
We can talk about epigenetic issues that affect weight. So, we're born with our DNA and everything. However, certain foods, drinks, even exercise activity can turn switches on or off. Right? So some things that will promote disease can be turned on just by eating the wrong foods or by not exercising enough or intensely enough. Or it can turn them on, So, yes. So we can manipulate good things or bad things. In our body.
Already in our body.
Yeah, epigenetically, just by the amount of exercise that we do, just by the types of foods that we eat.
Now you mentioned bad foods. I'm going to put you on the spot. What is bad food?
Yes,
I talked about good food, but what is bad food?
I don't like using the term good or bad, but that just kind of slips out. So I would say foods that are unhealthy for you. And so,
processed foods, sugar.
Absolutely, processed foods. Foods that just have, I don't want to say foods that have sugar, but foods that have too much sugar. Again, there's just always that amount of electrolytes and nutrients and so on that our bodies need. So just eliminating a particular thing because, like salt, for instance. I'm not eating salt. I don't want it to have a problem with my blood pressure. Your body needs salt. You're going to feel like crap eventually,
right.
So unhealthy foods, processed foods for sure. You know, foods that, you know, just
have ingredients that you can't read. Things like that.
That would be lots of preservatives, right?
Yes, exactly,
To lengthen the shelf life, exactly.
Yeah.
Foods that are too high in fat. So again, everything in moderation. So it would be really important if you know how to read a label,
sure.
because then you can determine what you're taking and what you're putting in your body. Anything that's fresh that you can pick, that, you know, doesn't require too much manipulation, is most likely going to be best for you.
Do you think we're reading enough labels in the back of
no.
foods?
No,
we have no idea what's in the back of these foods. I mean, we have no idea what it says, right? We just
well, we trust the FDA.
Yeah, you do. Okay, I'm gonna go to the next question. Debbie has ideas for women over 65 for weight loss.
The first thing I'm going to push with that is exercise. Exercise activity, because 65 or older, your metabolism has slowed down. And so the exercise activity is going to promote that. It's going to increase that. So exercise activity is really important. Monitor your fat intake. As we get older, again, it's more difficult to lose weight. Monitor the fat intake, because you get double the amount of calories from fat. You don't want to eliminate it completely, because fat makes you feel full. And if you're not feeling full, you're going to eat more.
Sure.
So I would say first thing you want to do, if you've never met with a dietitian, is to meet with a dietitian, so that someone can evaluate your diet and can really help you promote weight loss and certainly prevent more weight gain.
And then when you're eating fats, go for the healthy fats, right? So avocados.
Avocados are awesome.
Mediterranean diet kind of stuff.
Yes,
great.
Absolutely.
Fish. All right, and then I have Joan. Why can two people who eat the same foods and have the same activity level have very different weight loss issues? Are those genetic? That's
because
a very
we're
good
different,
question.
Joan. We're
It's a good
different.
question.
We're
It's
different
like,
people.
Yeah.
We have different makeups,
Everything.
different genetic makeups. Absolutely, she was right on that. And then it doesn't matter that you're eating the same types of food. Your exercise activity also plays a role, but really it's mostly your genetics, right?
Sure.
So that's going to play more of a role in terms of how you're losing weight compared to someone else. However, there's like an overall, what's the best way to put this? For instance, as medical providers, we know there's certain things that will absolutely promote weight loss.
Yeah.
So you're going to get weight loss from that regardless of, but you may not just get the same type of weight loss as the person. Exactly.
Not as intense as
exactly.
Else.
Exactly, just because of that makeup. And
now, I know a lot of people do a lot of like meal plans and they eat kind of like the same thing every day. Is that healthy, or should we be rotating foods? Because I heard you say it's all about kind of variety, moderation. Is it healthy to do a meal plan that's like all chicken, all broccoli every day? You know, that a lot of people kind of pack their own lunches that way, and I've kind of seen a trend in that. But when you're saying, you know, make sure it's colorful, it sounds like we should always rotate our food. Some day chicken, some day steak, some day salmon, some day vegetarian.
Well, the thing about eating the same types of foods daily, like you said, number one, you're going to get bored. So eventually you're going to get really bored. You know, you're never going to want to eat that food again, and that food's probably important. And you're right. There are probably a certain amount of nutrients you might not be getting if you're eating the same things every day. Of course, that can be supplemented with vitamins and minerals. So it depends on whose meal plan you're following and what supplementing nutrients that you might be missing, if you are missing any nutrients indeed. Right? You definitely want to talk to your medical care provider regarding that.
Great. All right, and Lynn wants to know, how do you lower your BMI?
So
is there one answer to that?
So lowering your body mass index really is saying that you're losing weight, but also I think what we need to understand about the body mass index is that it cannot tell us what our fat mass is or our muscle mass is. So I can tell you that our star of Cleveland, LeBron James, has a tremendous amount of muscle mass. So his BMI would probably fall into what we consider an abnormal range, right? Does he need to lose weight? Absolutely not. So I would say it's not so much about lowering your body mass index, but is your weight, you know, where's your weight? Is it fitting into what's normal to prevent risk for disease or to prevent exacerbating any type of issue you might have right now? And so in doing that, you need to, you know, look at what you're eating exercise more, determine if you need medications, determine if you need surgery, those types of things.
Great. And then if you have issues with weight gain, you can just, there's BMI calculators online that we could just
There are BMI calculators. Again, it's not telling you what your fat mass or muscle mass is, right? You absolutely need another test to determine that.
Okay.
Because if your body mass index is elevated because of your muscle mass, why do you need to lose weight?
Right. Unless you're not working out. Okay, great. And then I have Joan. What about some of the current thinking that says the bacteria in your intestines can determine weight issues? And I'll talk a little, I would like to talk a little bit about the bacteria, the good, the bad bacteria that we have in our bodies and all that good stuff.
Yeah, there are a lot of studies out there now that are saying that the microbiome or the gut bacteria is having an influence on your weight. I am not well versed in that. We have a wonderful center here, Center of Functional Medicine, and they will run a gamut of tests to determine, what might be abnormal along that spectrum.
Okay.
I do understand that I think if you take certain probiotics, and you do certain eliminating diet types based on what the bacteria is, that would be helpful. But again, you want to go to the to functional medicine, the Center for Functional Medicine, to get that evaluated and assessed.
So from what I understand, you have bacteria in your body and you want to give them good bacteria to feed the good bacteria. But do you consume apple cider vinegar? Do you have anything to say about apple cider vinegar? Is that because you have people kind of going all over the place with the apple cider vinegar. Is it making me, lose weight? Is it enough research that put you on the spot again?
No, it's because I can't stand to hear apple cider vinegar.
See, let's talk about it.
So, well, the truth is I don't actually know where that's coming from. The whole thought that it's just one of those things that's out there. If you do more apple cider vinegar, you're going to lose weight or whatever. Perhaps it might dull your taste buds or something. Perhaps, but it's very acidic. I was about to say it's very acidic. It's changing your pH. There are studies that show if your pH is altered too much, you're setting yourself up at risk for other things. I have yet to see one person who's told me that by drinking it they've lost weight or had any.
It's hard to drink. Some people put it in water and just sip on acid all day. Versus sometimes I'll put it in a salad dressing because I'll put vinegar anyways.
It's just different.
But
It's just different.
Okay,
so
cool.
that's myth.
All right, good myth. And then are any foods free foods?
Water.
There you go. That's your answer. Not lettuce, not romaine, nothing like that. That would be. That's.
So again, I think we need to. We like the idea of free in every aspect.
Sugar free.
Right? However, I think when we say free, when we talk about free in relationship to foods, we're just saying how much of this can we eat without a penalty?
Right.
And so again, it then falls into what amount of food do you need to consume or beverages to not gain weight? Okay. So if you're going above that, nothing's free.
Yeah. Okay. Look, that's the right answer.
With the exception of water.
Yes, water. Okay, great. Sorry if I'm butchering this, Sir Monty. Is it true that bananas should be avoided?
No.
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 Okay.
No. So bananas are a great source.
I'm not sure why. They're potassium.
So I'm going to talk about that, right? Bananas, great source of potassium. It's almost like a starchy kind of fruit. It's got vitamin C also. However, it also has a lot of sugar. And especially the riper it gets, the more sugar that's there. So when people talk about avoiding bananas, they're really talking about reducing sugar. Okay. So if you are on a low sugar diet plan, or you want to do that, you should definitely reduce your intake of anything that's full of sugar, whether it's a fruit or a processed food.
Okay, so bananas should not be avoided.
No, they should not be.
Everything in moderation, right?
Yeah.
Okay.
Yes.
Faith, are there foods to avoid while on prednisone or any other steroids?
So prednisone tends to increase the appetite, and so it also reduces inflammation.
Oh, okay.
As far as I know, there's not a problem with consuming any type of food or beverage if you're on prednisone for medical reasons, but you want to monitor your portions because it does make you feel more hungry.
Okay, great. And then Faith also asks, is decaffeinated healthier than caffeinated?
It depends on how it's processed.
Oh.
Right?
Oh, it gets so complicated.
Right, right. So are we really talking about the effects of the caffeine, no caffeine? Or are we talking about the effects of how the caffeine is taken out of the coffee, and that chemical process could be an issue.
So how do I know how it was taken out of the coffee?
Yeah. Well,
just know your sources?
Some companies actually will say at the back, if you look, some, but no, you have to investigate, Google, look it up, and see.
All right, cool.
Yeah.
Will wants to know, if weight gain is one of the side effects of your medication, how do you lose weight?
Yes, that's a really great question because there are a lot of medicines out there that do promote weight gain, and that's where there needs to be a conversation with your medical provider who's giving you that medicine to discuss other medicines that can combat that.
I see.
Because it's really quite you know, it makes you not feel so great. You've got to take this medication to support this thing, and then it's causing the weight gain.
Right.
And then the weight gain is going to cause something else.
Yeah.
So I think as medical providers, we need to be very aware of the medicines that we are giving to our patients, and that if it's going to promote weight gain, we then need to make sure that person has resources to prevent the additional weight gain. Yes,
sure.
Yes.
Okay, great. And then I have Lynn. I have severe sciatic pain and walking, moving hurts. What can you do to exercise? Also, tried the pool, still aggravated the nerve. What can I do?
Okay. So sciatic pain is really, I mean, that's incredibly painful.
Yeah.
However, it depends on how it's being treated. You know, Lynn can go to a chiropractor and osteopathic physician, and they can do specific manipulations to relieve the pressure off the nerve. It's the sciatic nerve that's causing the pain. But if you're going to have pain, experience pain when you're walking or moving, that is, you know, going to prevent you from, you're definitely not one going to do that much. So treating the source of the pain, she is going to be...
Not just the symptom, but the source of the pain.
The source, exactly. Because you can do both. She can get some things to help with manage the pain, but the source of the pain needs to be treated. And typically with sciatic nerve pain, the nerve is being compressed or impinged, actually.
Right.
And there needs to be manipulation and a few techniques to open up that area to relieve the stress off the nerve, to relieve the pain.
Very, very good to know.
So going to the root of it.
Okay, great. Laura wants to know, is eating 3 to 4 servings of avocados a week too much?
Laura, are you eating avocado toast? Are you paying a whopping $8 for a slice of avocado
let's just say avocados, but servings. What is a serving? Like 1 avocado a day is probably too much. Are we supposed to eat half of an avocado a day? What is too much?
You know, I'd have to go look to see what the exact serving is.
Okay.
I mean, avocados come in all different sizes.
True.
And so I'm not sure what a serving is without looking it up.
Yeah.
So if she stays within the serving, and if a serving is, you know, like a quarter of a small size avocado per day.
No toast. With toast. What do you have against the toast and avocado?
It's more calories.
Yeah, I know, exactly. Stay away from the toast. I agree with that.
It means less avocado.
Yes.
So yeah, if she stays within the serving size, and I'm sorry that I don't know what the serving size is, but my trusted registered dietitian would.
Yes.
She would be okay.
Okay, great.
Yeah.
Faith wants to know, she's saying, can you explain when a diagnosis is morbidly obese?
Oh, can you repeat that again?
Can you explain when a diagnosis is morbidly obese?
Yes. When someone is diagnosed as morbidly obese, it's because their excess weight has hit 100 or more pounds.
Okay.
And that will push the body mass index into the number of 40 and above.
Okay.
So we've got 40, you know, morbidly obese, then you get to 50, you get to 60, and then the terms become super morbidly obese, you know, and that's a condition that really meets the criteria for surgery.
Okay.
And if with all the investigation and evaluation, that's something that person should do. That's definitely the path to go on. But once you've hit the body mass index that reflects a morbid obese state, it really puts you in this realm of all these disease processes that just makes life more difficult to manage.
Sure.
right? And it is incredibly difficult to lose that weight non-surgically.
Sure.
But yes, typically 100 pounds or more is what will qualify or classify someone as being within morbidly obese state.
Now, Thomas, when would you recommend bariatric surgery? That kind of ties
is that
in, huh?
Dr. Thomas Rugula? I've outed you.
So when do you recommend bariatric surgery? I mean, would you say 100 pounds or more overweight?
From the medical provider perspective, I'll recommend bariatric surgery based on the criteria, and I can go off into that criteria, and I will.
Okay.
However, what I have noticed with my patients, you cannot do anything until you're ready for it.
Okay.
And so first, the patient has to be ready.
Yeah.
The person who meets the criteria needs to feel that this is the path that they're going on and be ready for it.
Yeah.
So,
because it's mental and physical.
yes.
The mental part is huge.
So from the my relationship with my patient, that's what I'm looking for. You know, being ready.
Yeah.
Okay. But in terms of the clinical criteria and when I would recommend bariatric surgery, if your body mass index is 35 or more, and you've got a condition like sleep apnea, diabetes, some other type of chronic disease issue along with that body mass index, you fit the criteria, you meet the criteria for bariatric surgery. Okay. However, if your body mass index is at 40, you do not have to have any other chronic disease issue to meet the criteria for bariatric surgery. Okay. So again, people who are 100 pounds or more overweight, it is so incredibly difficult to get that excess weight off. Sure. By manipulating food, because we have to eat food every single day, you know? Yes. And so there's that gray area always of, you know, what can I eat, what can I not eat? And to think that you have to do that for the rest of your life can be pretty daunting. Sure. What I love about bariatric surgery is that it is the tool that supports. It is the tool that can give you back a certain quality of life. Yes. It is the tool that can do a lot in a shorter period of time, but it also helps you maintain the weight once you've lost it. Yes. So as long as you're following the criteria of, you know, choosing right foods and exercising regularly, portions. I advocate bariatric surgery for anyone who meets the criteria. But again, you've got to make sure that the person is also on board with it. Right, right. So
because it's kind of like a lifestyle change after that, right?
Yeah, yeah.
Okay, so let's see. I have Diane. Is cheese really a bad food? Is it?
Who's calling cheese a bad food? I want to know that.
I don't know.
So again, let's take out good and bad. And let's
mac and cheese from the store is probably not a good food, I'm guessing. That's
she did not say mac and cheese.
No, but I mean, there's cheese in the mac and cheese.
That's
what my kids try to tell me.
So cheese is pretty high in fat, very high in fat and salt. However, it's also a good source of protein. Again, it's about how much of it you're eating, right? Yeah. So you can eat cheese, yes, if you're not lactose intolerant.
Sure.
Yeah.
Sure. And the quality of cheese, I'm sure, is a big thing.
Yes, the quality of cheese, you know, from cows that are, you know, grass-fed and so on and so forth. Sure. So it's about, is it healthy or unhealthy? It is healthy in moderation.
Okay. Okay.
Yes.
Healthy in moderation.
Yes.
Okay, so Amy wants to know, well, I love cheese. I basically put it on everything. Is it that bad for my health as well as my weight? So, in moderation would be the answer.
So cheese is a high source of fat, so it depends on how much of it she's eating. She may say she's putting it on everything, but how much of it is she putting on? It may not be that much at the end of the day.
Okay.
Again, it's, you know, how much of it.
Fine.
How much of it, yeah.
And then Jill wants to know, how can you control menopausal weight gain? The inevitable.
The inevitable.
Yeah.
You know, you've got to be really diligent with the exercise activity. I would strongly recommend weight training exercise, which also tends to do a better boost with the metabolism, particularly in that age range, or if you hit menopause surgically or for some other reason, because it also depletes your calcium stores. Your musculoskeletal system is not as strong, and so it's really important to do some type of strength training or you know, core yoga, Pilates to keep your musculoskeletal frame strong. But then that also helps increase the metabolism. watching the diet, bringing the fats down, increasing the protein, staying away from the processed foods, reducing the sugar. I could go on and on.
No, you can keep going. It's fine.
Yeah.
Okay, so Sandra wants to know, how do you know if you have insulin resistance?
That you absolutely need, well, first of all, you may have some symptoms, Sandra, and she may have some symptoms, but definitely you need to connect with your medical care provider, because there are certain blood tests that can be done to determine that, to definitively determine that you are insulin resistant, which is not a good thing, because that means that's setting you up for diabetes. So the insulin resistance will spur you into pre-diabetic stage and then a diabetic stage. So it's really important, if you're not feeling yourself, to make sure that you get a check to eliminate that, as well as other things, depending on your symptoms.
Okay. I'm going to kind of touch back on pregnancy a little bit, because you can get, was it gestational diabetes?
You can get gestational diabetes in pregnancy, yes. Yeah. And so, again, that's why it's really important to monitor what you're eating, how much you're eating. And really, I just think we need to develop great relationships with dietitians. Sure. You know, it certainly helps to have someone review our diets every time we're going through a phase of something, or even if we're not. Sure. You know, if you want to be healthier, well, let me also check in with a dietitian and see, you know, if I'm eating the right foods and in the right amounts. Pregnancy is one of those stages where you should definitely be meeting with a dietitian. If you're perimenopausal, you know, post-pregnancy, if you're thinking of having a baby, if you have any disease type, really it's always very good to check in. And yes, so some women have a tendency to get gestational diabetes during pregnancy. It's connected also to increased weight. Okay. And so not always, but it is. Right. And that's why what you're eating, how much you're eating, and how much you're exercising is also really important during that time frame. Okay.
Great. Knowledge is power. Okay, Lori, one last question. Lori, can you talk about whether a high good fat way of eating is more healthy, and the big part that insulin resistance plays in weight?
That's a twofer, Lori.
Okay. So first, let's talk maybe about the high good fat way of eating. I mean, there's like the ketogenic diet. And
I think what she is alluding to is what's out there. You know, everyone's saying keto, 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 go keto.
Go keto.
I know.
Dance moves and everything.
Yeah. Which I really want to break down that term. You can eat in a way that can promote ketosis. Right. And what ketosis is, that state of ketosis, is fat storage, fat cells being broken down. It releases ketones in the urine, and that's when you're in the state of ketosis. Well, the way you do that, the way the body does that in a normal, healthy way, is by using the fat as a secondary source of fuel. Okay. So if we're pulling out the carbs out of our diet, we're pulling out the sugars, then our body's going to turn to the stored fat to utilize that for energy or for fuel. It's going to break it down and release ketones in the urine, and that's the state of ketosis. What's happening a lot right now, or the trend is, that also promotes a lot of weight loss, right? And so the trend is to do a diet higher in protein, reduce the carbs, but then also increase the fat, right? And so that's shown to help you lose weight, and it's also a healthier way. However, you still have to monitor how much fat you're taking in. Right. So it's trendy right now to say go high fat, go high protein, you know, less carbs, but you still need to monitor how much fat you're taking in.
Okay, so how do you get to ketosis? Is it taking down your intake of sugar and carbs, correct?
So when your body gets to that stage, yes, of it's utilizing your fat storage as a form of fuel, right? Yeah. And most often that happens when we reduce our sugar intake or carb intake, because our bodies really prefer that it's primary source of fuel. If we remove that, it's going to a secondary source, which is the fat.
And go for the fat.
Right? Great. It's going to go there, and it's...
Don't know which.
Yeah.
Great. Okay, well, that was the last question, but before I let you go, is there anything you want to tell our viewers that we haven't touched on? I know we talked a lot about a lot of things.
We've touched on a lot of things. I will always advocate exercise. It is our best kept secret for optimal health. Yeah. For those people that have difficulty moving, if there are alternative forms in terms of water, if there is assisted movement like Pilates with the reformer, physical therapy, that's really helpful. But really, truly, in terms of our health, eating a balanced diet, and if you don't know what that is, check in with the dietitian.
Sure.
Just making sure you're getting enough nutrients and you're taking in enough calories to support your body is one of the best things we can do for ourselves. Oh, also getting enough sleep. That's important.
Oh, yeah, sleeping.
Get
Yes,
enough
definitely.
rest.
Great.
And get some joy in there.
Yeah, happiness is important.
Yeah.
All right, well, you've been a rock star. Thank you so much.
Yeah,
This has
thank
been
you.
great.
Thank you.
As for our next Facebook Live, it will be on Tuesday, May 22nd, 3 p.m. We will be, again, putting you first by talking to Director of Primary Care Women's Health, Dr. Laura Leopold, about women's primary care. So make sure you guys tune in. And for more health tips and information, please follow us on Facebook, Twitter, Instagram, Snapchat, at Cleveland Clinic, one word. See you again next time.